Can I start now? I'll be waiting for someone else.
No, let's start, doctor.
Okay. Good evening, dear doctors. Thank you everyone for joining in. I know that among all of you who have joined this session, few have already attended the initial orientation session. Actually, this is the second orientation session which we are giving. So, I am Dr. Litivi Raju and I would be the academic coordinator for the postgraduate diploma in Ayurveda nutrition course, and proudly saying this is the fifth batch of nutrition, and the fourth batch is ongoing and they're appearing for the exam by October end. They have successfully completed almost the syllabus and one more month is pending for them. So by today's session, what I intend is to give you a glimpse of what we would be covering in this nutrition course. I'm quite sure you're here for that itself. I don't have to explain you much about why a nutrition course is much more relevant for a clinician or a practitioner, which you all are. Because see, nowadays all the patients who are coming to us are completely informed. They know a lot of things. They have Googled it. Many are reading the article. Many are professionals, and what they demand to us is to give something very tailored to them, something very personalized to their condition, rather than just giving a random, generic diet like use just the low glycemic index for diabetes, or just avoid spicy oily food if you have acidity. Instead of just giving the generic thing, what if you can identify their prakriti, vikriti, everything, and tailor a diet and provide to them? So this is where some of the time we lack, uh, I can say that, a rigid knowledge there, and we lack the knowledge of how to integrate the terms which we read in modern terminologies, right? Modern dietitians prescribe this calories as per this much of carb, this much of protein, fat, everything. So sometimes we fail to interpret that itself. So in this course, we intend to integrate both this, the vast Ayurveda knowledge which we are having in terms of ahara with everything, and the modern terms, and integrate it and how you can reproduce it in your clinic practically. Okay, this is the whole agenda or whole program we intend to do here. And just giving you a brief about Ayurveda map and what does it is an educational platform, I can see. More than that, it is a movement, I can say, because what they really focus is for building Ayurvedic doctors who are not just like a healers or something, but who are having a high skills, uh, and compassionate, ethical, and globally aware of what is happening. That is what Ayurveda map is completely intending to do. Just build the skill set. After completing BMS, just BMS or MD also, we lack some of the area skills. Some maybe not may not be knowing much more about the nutrition. Some may not be knowing much more about the yoga session. So this is completely to give you a specialized skill set of nutrition. Yes, and MedMap was founded by Dr. Jasul Alinkal. He's a visionary in the integrated healthcare sector, and he has been mentored by some of the most respected names in Ayurveda, and is completely committed to a structured learning and mentorship program. Yes, the program, actually, being an academic coordinator, I can say that I'm not just being an educator here, but this entire program is close to my heart actually, because it help you understand firsthand how deeply nutrition impact a patient outcomes, and this is designed to empower you with expertise in Ayurveda based nutrition, dietetics, and combining both the knowledges here. And by the end of this course, you will be able to understand both the modern principles as well, interpret what are their terminologies, and create therapeutic recipes and guide the patients towards a holistic wellness. That we can assure you. So basically, if you ask me, can you split it into 4, 5 headings and say what this entire course module is about? It contains starts with the basics of nutrition. Ayurveda physiology part would be there, nutrition across life stages, clinical and sports nutrition regarding performance enhancement, it would be there. Nutraceutical topics would be covered. Now let me give you a walkthrough about what exactly under each. Obviously, the course cannot be started without giving you the fundamentals of nutrition or fundamentals of ahara, anatomy, physiology, basic idea what you know should know about the digestion and metabolism thing. So obviously we'll start with the nutrition foundation, which includes the basic nutrition, its functions, classifications, and some of the terms you should know there. Then human physiology and Ayurvedic correlation. So what we do here is you will be like we'll make sure that you cover refresh both the modern part of physiology and Ayurveda, how it is interpreting. Both the places will cover the foundation. And nutrition and dietetics and samhitas would be there. Then coming to the applied nutrition, that is where nutrition in different life stages we will be covering. Right, starting from the infant, like pediatric nutrition, adolescent nutrition would be there. Then moving to sports nutrition, women's health and nutrition, geriatric nutrition would be there. Then clinical nutrition regarding to specific diseases. Clinical nutrition in regards to the gut disorders, liver disorders, thyroid disorders, right? All those will be covered. Most importantly, how a diet prescription is done and diet counseling is done, and food drug interaction. Because another important topic is Viruddha. Viruddha, not just the classical Viruddha, what we learn, and most of them which are not practically available, we know. None of them are being practiced, also, we know. But we make sure that we are having a great faculty called Dr. Megha. She's completed a PhD and she's an Ayurveda biologist. She would be looking into this Viruddhahara topic in a much more different aspect perspective of an Ayurveda biologist, and she completely explains the nutrient interaction there, which we should be very cautious when we explain some of the diet. And some of the patients, you maybe see that HB is not at all increasing after even after taking a lot of leafy vegetables, paneer, everything. So but there, what the nutrient interaction is happening, or what is restricting from the absorption of iron into the body, in that critical manner we'll be dealing with nutrient interaction topic. And we have much more advanced topics like nutraceuticals, then food hygiene and production basics, all those things will be covered. And yes, so this, if you ask me how this program is, since you all are from different part of India, this is not, and maybe if you are from out of country also, because current batch we have students from UK, UAE, everywhere. So this comprises of online and offline learning, but it doesn't mean that you have to come and travel back and forth. It is not like that. The entire class, starting from the next month up to around a year, it would be completely online mode. And towards the very end of the course, that is when you will have to give an offline exam at Calicut. That is the time where we'll be having around 3 days of exam plus workshop. In workshop, you will be having a hands-on practical where you will be preparing the recipes. There will be doctors who will help you prepare the recipes, teach you the preparations much more, and we will have active case discussions, diet prescription discussions, everything would be there. That is and also last day of that you will be having a written exam offline. So this would be a pattern of the class overall, if I can say. And monthly there will be live sessions, like around 3 to 4 live sessions would be there every month, and followed by expert-led discussions. Because we ensure that last half an hour of every course, every class is packed with much of your discussion points. You bring with your in your clinic in that current week any of the cases you have got, and you're doubtful about a particular diet. In that, we make sure that students get the opportunity to ask all those in their live sessions itself. And examination center will be at Calicut, Kerala. And now let me introduce you to all our faculties very briefly. Starting from Dr. Shabil Ibrahim, so would be completely covering the topic of physiology. Dr. Mumtaz Khalid Ismail ma'am will be taking the basics and fundamentals of nutrition in modern perspective. And Dr. Kashina Samagandi sir, most of you would be knowing sir, and exclusively with the topic of Ahara Varga, sir would be dealing with it. When you hear Ahara Varga, you may think that, okay, oh God, again back to Shaga Varga, Shimpi Varga, Shugadanya Varga, have to learn all the things. But it is not that way. We make sure that from the Ahara Varga, we clearly understand what from the currently available ingredients, what all falls under each category, what are the specific guna karma based on dosha, everything. And based on that, how you can use those food ingredients or Ahara Varga in your diet. Like diet prescription thing. In that way, it would be tailored. So I would be dealing completely with the Ahara Varga topic. And most importantly, we have Dr. Nikhila ma'am. Ma'am would be dealing with the dosha vikriti based diet prescription, and some of the clinical cases would be discussed there. Dr. Neetu C. Mohan, she would be dealing most importantly with the thyroid conditions, gut disorders, and liver disorders, how an Ayurveda prescription and how diet prescription taking into consideration the Ayurveda basic principles, how it should be made. And next we have Megha, Dr. Megha. She has completed a PhD. She's an Ayurveda biologist at TDU Bangalore. So ma'am would be dealing exclusively with nutrient interaction and Vidudahara topic. And we have Dr. Geeta Dharmati ma'am. Ma'am is a modern nutritionist based on Mumbai. Ma'am would be dealing with nutrition in different stages of life. Very beautifully, she explains everything. Modern portion it is, but very important for us to understand those topics so that we are clear when a patient approaches us with certain doubts. And most importantly, there's Valsala Devi ma'am is there. Ma'am would be dealing with integrated diet, how to prepare an integrated diet. She would be there, diet protocols, balanced diet aspect, and postnatal care, postpartum care diet aspect. Ma'am would be dealing. And Dr. Niyati Shivan, ma'am would be dealing with the nutraceutical portion mostly. So you are already aware about the course fees and the offers, everything. It's a total fees of 36,500, and if there is a 10% of off for full payment. And if you're Ayurveda MAP alumni already, you'll be having 2% of off. And the bonus session, you will have free thyroid and diabetes management courses as a bonus session. Now, these are some of the glimpses of the previous practical sessions we have arranged in the last batch, which was in Calicut. So, see here you can see all the preparations and most of the diet preparations students have prepared, the faculties with the coordinators, everything. And the end of the day, we had a valedictory section where everyone just assembles and gets the certificates, everything. Just for your information.
I'm an RD doctor, so I travel.
Can you hear this? Is the sound?
I'm an RD doctor, so I travel around a lot. Most of the doctors, they don't.
Can you hear? Please respond. Was it audible? I can see the screen. Audible. Okay, thank you. I'll just.
Thank you, everyone. I'm Dr. Vedapriya. I'm from Bangalore, working as a consultant in a government sector. Our prescription doesn't go with, explaining patya to a patient. Even if we do not advise, patient themselves will ask, is there any patya to be followed along with our medicines? So I thought of, adding more knowledge so that we can quantify what we are advising instead of vaguely advising the patient what to take, what not to take. So I thank Ayurveda MAP for arranging high profile faculties to enhance our knowledge. Thank you.
I'm an RD doctor, so I travel around a lot. Most of the doctors, they don't think about diet. They just prescribe medications and then they think that's it. And when I started listening to the classes, either I learned something new or I understood the whole thing even better. And I especially enjoyed Dr. Kashinath's class very well, and ma'am, your class too. And I want to thank the faculties for keeping us in touch either online and offline. All the training sessions were also very useful and interactive. I reluctantly joined the course, but now if I have missed it, I would have regretted it. But thank you, Dad, and thank you to the faculties.
Yeah, so that was a few of the talks from our previous batch students during the valedictory function. Let me walk you through some of the upcoming courses which we are having. Postgraduate diploma in Ayurveda cosmetology and trichology is there. We do have a course in professional diploma in Ayurveda Panchakarma. There is diploma in antenatal and post care in Ayurveda, and Sthanika Chikitsa in Stree Roga is there. And we have short term courses like Varnyam, Veni, etc. Yeah, this is the contact and the support details of MedMap. Here are the mail IDs and the WhatsApp numbers for which you can call and contact anytime. So yes, that is about a brief about the how the session would be planned, how the classes would be. Now the time is for any of the questions you are having. I think most of you are here with a lot of questions. You may be having how it will be prepared, how the notes would be provided, everything. So after every class, the class recordings would be uploaded in your website, in your course especially, and the notes of the respective classes also will be uploaded in the course, and you can access the note and you can start rehear the recordings and prepare the notes. And towards the end of the course, we would be sending or sharing you a module. Yes, Valsala ma'am has joined here. Just one introduction. Hello, ma'am. Welcome.
Hello, good evening.
Good evening. Very good evening, ma'am. Thank you so much for joining. Dear students, as I have introduced in the slide, Vatsala Devi ma'am is here just to give you, welcome you all and give you an introduction. So ma'am mainly deals with the topic of postpartum nutrition, balanced diet, how it should be integrated, and integrated dietary protocol. A very beautiful class, very informative, and lot of new information we get all the time from ma'am. Over to you, ma'am. Please say some few enlightening words to the students over here.
Thank you, Liti. Good evening, Dr. Jasul. So, good evening to you all, dear prospective participants of PGDAN. So, as I was listening to the feedback and all those things from the previous students, we say Ahara, Nidra, and Maithana are the three pillars of Ayurveda. So, and Ahara is the first and foremost. The other two we can get along with to a certain extent, even without by compromising them. But Ahara, it is very important. So it goes as a very common saying as like, if you eat food as medicine, you need not eat medicine as food. So that should be our principle while we are practicing. Every time what I feel for the past 35 years, I'm in this practice field. Whatever I feel is medicine can do only a little, only the 50% of the job what we intend to. The other 50% is mainly food. So that is and our acharyas say food has to be hita, and in others the context say that it has to be priya. So our job is to make the food hita and priya. That is what Ayurveda nutrition should be aimed at. We see a lot of things going on in the name of Ayurveda nutrition. So many things coming up, vata drink, pitta drink, so many things coming up, which are partly scientific, partly very unscientific. So it has to be whatever food you give as part of the protocol or as whatever you advise as part of the diet regimen should be holistic and conforming to the Ahara Vidhi Vishishta Ayatana. This is what my concept of the classes would be. And I think I would be handling 1 or 2 theory sessions for you, and also the main practical session where we will be giving you some kind of recipes and you will be preparing. So it would be a hands-on workshop where you will get to know how to adapt the traditional knowledge into the present scenario and to dish out new recipes that would be like what we call as that would match what we call as the foodicin concept. This will be what I will be handling with, and as I told you, with 35, I finished my graduation in 94, and since my house surgency day, I'm in the field practicing clinically, and over the years, so many exposures have given me the opportunity to evolve in the field of nutrition, learning new things. Every time when I interact with PGDA and students also, I do learn new things while sharing what I know. So this is always a learning process and a very happy one. And I thank you, MedMap, Dr. Jasul, and Thank you, Liti, and over to you. This is what I got to say. If anyone have any, I have some emergency work to get into. So if anyone has any questions for me, I am welcome to answer them now. Or else you can go ahead.
Thank you
And
so much,
grant
ma'am.
me permission to leave.
Thank you, ma'am. Thank you, ma'am. In spite of your busy schedule, thank you for finding that few minutes of your time and just giving few really relevant words, I can say. And anyway, everyone will get to experience your offline session. So you will get to know ma'am in detail and they can ask a lot of doubts, case discussion, everything can happen. So waiting for a very beautiful and productive fifth batch, I can say. We are waiting for a very productive batch. And we look forward to have you both online and offline, ma'am. Thank you so much from MedMap and
Thank you.
Ayurveda.
So
Take care,
if
ma'am.
any of the participants have any questions,
Doctors, do you have anything to ask to ma'am directly? You can either unmute or put it in the chat if you have any.
I think none.
No, ma'am. I think this is
yeah,
an orientation
yeah.
class. Everyone is getting
Yeah,
to know.
yeah. I understand.
Thank you so much, ma'am.
Very sorry I have to leave. Please grant me permission for that. And over to you, Liti. Thank you. Thank you, Dr. Jasul.
Dr. Jasul, would you like to add something? Meanwhile, dear doctors, if you have any doubts or any questions you want to ask regarding the course, how it would be the pattern, exams, anything, please feel free to pitch in here.
Good afternoon, all. So, welcome to the fifth batch. So, this is a great opportunity to get the knowledge from the most eminent faculties in the Ayurveda nutrition sector. And for you, this is not like a regular course. This is this is your choice. So, you have to commit to it for the maximum. Getting a degree, getting a diploma is simple, but you have to work on, you have to practice, you have to help the patients, and without the medicine itself, you can treat them. And so many of our alumni are treating having patients from various countries, and they will be treating without the medicines itself. In that countries, even the medicines are not even available. They are only focusing on the lifestyle, their diet, and the simple changes are there, and making so much difference in their lifestyle. So this is a great opportunity, even if you are, if you don't have a space to work or practice, or if you have a long, lengthy career break, you have a good option to restart your career through this course. You can even practice from your home, from your clinic, or even with your general practice. You can have a section of Ayurveda nutrition there. So much scope, so much opportunities are there. So it's your turn, and we will be pushing you from our side in this entire course to attend the sessions live, go through the recordings, go through the modules, and in between there will be assessments to improve your knowledge. So be with us. And we have Dr. Liti with us, and she is the current coordinator of the fourth batch itself, and she's very enthusiastic, and you can ask doubts to her itself. We have a Telegram group to solve your doubts, and if you need more clarity, you can ask doubts there. So that is a great opportunity for you to learn. And we have right now around 23 participants. So if you have anything to say, or if you have if you need any further clarifications, you can ask. or you can just introduce yourself. Previously, so many other already enrolled students were introduced, and any new participants there, you can introduce yourself and with your name and actually what you are looking through this course, or how you are planning your career upgradation through this course. Okay. Okay, Dr. Litti.
Thank you, Dr. Joseph, for adding in few points. Yeah, as Dr. Rightly said, what we can say is just to restart. Most of the doctors who have joined yet, one common feedback or one common idea everyone shared is many of you who are hesitant to restart your career, okay, or you have taken a long break, maybe due to maternity, pregnancy, anything. All those cases, when you have to restart something, you need some additional skill set, right? Just to, how to say, it's kind of how to keep you updated and stay in track with the most updated patients. Patients are most updated. So how to stay in track to track with them means we have to upskill ourselves. And this is the best upskill course I can say. Rightly, like Dr. Valsala Devi ma'am said, Ahara Nidra Maithuna is there. So Ahara covers most of the topics. Once you thoroughly, because your role is very much important in this course, even though we provide you with the live session, direct interaction with the faculties, we clear your doubts, we arrange the syllabus according to the priority assessments, everything is done. But as Dr. Jasul said, the real commitment is from you, how importantly you take this course. If you want to just take it as a certificate course and just run away, or understand the maximum out of it and put it in your direct clinical practice. This is a life thing happening, right? So 1 month you had a class of say like gut disorders, APD, NAFLD, right? Fatty liver disease, all thyroid you had, right? That month, what all cases you are getting into your clinic, whether it be related to any of the conditions, note it down, make a note how are you able to reproduce this diet practice and come out with the doubts in the next class. I completely insist on bringing most of the topics for discussion, interaction, real case scenarios. If we have that faculty class next time, we directly ask in the class itself. Otherwise, I email it or directly message to the faculties, get an answer from them and put it in the Telegram group. And most of the faculties are so open-minded that they even give their numbers so that you can directly interact with the faculties. So there are many provisions provided from our end. The only thing we need is your commitment here. So dear doctors, can you all come forward and just introduce yourself? How many of you have those who currently registered for this course? You can just come forward, just say your name. I would like to get to know each one of you. In current batch, all the 60 to 70 participants who attend the live session, I know each one of them one to one. So I would like to get to know the 5th batch students also one to one in detail. So it would be very good if you could come forward. If possible, open your video and just say hi and your name, where are you from, are you a current practitioner or how it is. I encourage everyone.
And those who need any clarifications can
Any
ask.
doubts?
Yes, doubts. And also,
Any clarifications regarding the course or anything, please come forward.
you can introduce yourself and why you joined this course. Like, what are you focused? What's your dream?
Along with that, please say what you expect from the course. Any particular area would you like to focus or something means I will surely make a note of it and make sure that those points are covered during the live sessions. Can we start one by one? Dr. Arati ji. You all are great practitioners, grown-up doctors. I don't have to call one by one like a school thing, right? You can come forward. Be free, come forward and just take this chance to introduce yourself. If possible, keep the video on. Otherwise, you can.
Hi, ma'am.
Hi, Dr. Ovia.
Ma'am, I'm Dr. Ovia.
Hi, Doctor. Good evening.
I have completed my BMS and I'm practicing as a consultant in RJR Herbals. So
Great.
daily I'm facing the same issue you're telling, like diet, every diets they're asking. And even though I have studied it, but I'm still struggling for that. Like specific and personalized, customized, I can't do it. So I need this course for that. Yeah.
Very well. Doctor, where are you from? Dr. Ovia, you're from?
Salem.
You're from Salem. Okay. Very,
Yeah.
very nice to have you, Doctor. I hope you
Yeah.
have joined the session, and surely your expectation would
Yeah,
be
just actually a random. I have I was searching for this, but I haven't joined it. I have to join. Yeah.
yeah. You can join as soon as possible. We'll start with the live session site from the next month.
Okay.
And doctor, since you're working already in a clinic, it would be very good because you would be, you said you are directly facing many patients, right? Who are
Yeah.
asking for a tailored diet. So in
Yes.
that case, note down those cases where you are failing, where you feel the difficulty. That is the most important thing. Note down in
Okay.
which area you are facing the difficulty in suggesting a diet. Note it down
Okay.
and be very active in the live sessions.
Yeah, sure.
Open-handedly ask all the questions. Our faculties
Okay.
are very well versed. They just deliver you with the right answers and right approaches.
Okay, ma'am.
So
Okay,
best
sure.
wishes, Dr. Ovia. We look forward to
Thank you.
having you in the PGDAN family. Okay.
Sure, sure.
Thanks.
Thanks.
Yeah, yes, Dr. Ovia. Those who need the registration details, just contact. That's just WhatsApp in this number. I put the number here. Okay, just send me a hi in WhatsApp. Okay. And
I think you have shared in the private, but I'll put it in. I'll
yes,
put it in the comment chat once. Yeah. Anyone else would like to come forward? Not anyone else. Actually, I want every one of you to just speak one or two sentences of this. We'll get to know each other. Anyone else? Next, doctor.
Good evening, doctor.
Good evening. Sorry, your name is not visible. Can you just...
Actually, I am Dr. Devu. I am
Okay.
from Trivandrum.
Hi, Dr.
Now I
Devi.
am Hi, ma'am. Now I am practicing at Devaprastha Hospital at Trivandrum.
Okay, okay, okay. I am.
Okay, ma'am.
Yeah.
So actually, I chosen this course to add the dietetic knowledges into my clinical practice because as we all know that today many of them were suffering from sedentary lifestyles. They don't know what type of diet they have to take. As we all say, for diabetes, don't take sugary or oily food items like that. We generally advise them, but
Yes,
specifically, we don't told them what to avoid or what to take.
yes.
So my main aim is to get more knowledge about disease specific or what particular diet we have to follow for this disease. That's why I mainly joined in this course, ma'am.
Sure, 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 Dr. Devo. It would be covered. This is what exactly we are looking, something more specific than just giving you with the common generic thing what we Google, what everyone get by using Google nowadays and the most advanced AI which is there. So thank you for opening up, Dr. Devo. We look forward to have you in our further sessions.
Okay, thank you, doctor.
Thank you. Thank you. Next, I can see many doctors here. Just an information, doctors, whenever you join from our official first class onwards, make sure you rename to your original name rather than the IDs or the mobile names and all. Because this your attendance will be strictly marked and it will be uploaded during every class. So it will be great to have your real name in. Thank you. Next, anyone?
Hi, ma'am.
Hi, Dr. Pamela.
I am Dr. Femila. I have completed BAMS and last 5 years, before 5 years, I am working, but for the past 2 years, I am not working. I am from Kanyakumari. I have shifted to India, sorry, Chennai. So now I am not working. So for this 1 year, I have to start studying about the nutrition. After 1 year, I'm going to start my own clinic. So
Great.
for the upgrade, I need this course. So I have joined this. Uh, Before I'm working also, more patients were asking about the diets, nutrition and all. So it is must for this for these years. This is the nutritions are most related subjects for knowing the patients. Mostly they are asking what we have to follow like that. So I think this 1 year I can learn more about the nutrition. So I joined this course.
Certainly, Dr. Pramila. And I hope that for your new startup or the new clinic, this would be a very good upskill course you have taken rightly, and this will benefit you. Thank you.
Yes,
Thank you
ma'am.
for introducing and
Thank
sharing.
you, ma'am.
Good evening, doctor.
Yeah, hello, Dr. Rajana. Good evening.
Good evening, ma'am. I'm Dr. Rachna. I'm from Karnataka. I came through this course from Instagram actually, and it was only condition was only for BMS doctors, and I was very happy by that because there are many nutrition courses like 1 month, 20 days. Like anybody can do that, and anybody can prescribe that. This was only for BMS doctor that interested me the most because we cannot keep saying have light food, avoid spicy food. So
Yeah.
something specifically we have to tell. We can't tell them to have peya, vilepi and all. So specifically to make them, which is easy for them to make and have. That is my intention, like to learn properly and prescribe every patient according to their disease.
Sure, got it, Doctor. Thank you for sharing the view. And whenever you say your views, like what you're looking forward from the schools, I sincerely encourage every one of you to attend the live session itself and interact with the faculties, come up with your discussion points, because starting everyone shows enthusiasm in attending the sessions. You will be sharing the points, discussing the questions, everything. And if you continue that till the end, I assure you that rather than just listening to the notes and passing the exam, you really upskill. You really
Yeah.
upskill. You get a lot of dietary recommendations, because see, faculties which we have here is very well versed in their particular area. Okay, I can really assure you that. So how much you grill and how much you test them and how much you take it from them, the more you gain. So the more you ask, the more they come up with. If you stay silent throughout the course and if you don't have anything specific to ask, then there won't be any use of this particular some of the classes, I can say. So be very active. Come not down prior to the class. Every class module 1 month. If the next month module, example August month module is there, means it would be shared to you in the July itself. So you can start preparing the questions. You can get to know that, okay, in particular to example the class, if the class is going to be on say like sports nutrition, simple. So make just assess yourself, what is the main thing I should know about sport nutrition, what I should basically know in my practice, what should I ask a faculty to gain more knowledge. So note down these questions, make a note of everything. Just for the questions, I always say the students that just for the questions you keep a booklet for yourself. Note it down when and where you get the question, when and where you get the thoughts, come up with that and discuss with the faculties. That will really help you. Thank you, Dr. Rachana, for sharing the view,
Thank
and
you.
look forward to see you in our next classes. Anyone else? Doctors? So those who haven't registered it, make the hurry up the procedures, I can say. And if further any doubts you're having related to the any clarification you need related to the course or how this and their process would be, how the assessment would be, everything. And you would be given assignment as well. Every quarterly you will be getting an assignment which you have to submit online itself. And this assignment, don't think that any textual or just the theoretical assignment part I will be giving. After thorough discussion with the faculties and after thorough brainstorming, I can say very fine assignment topics would be given to you. That assignment will really help you in your clinical practice. You can keep that assignment handy with you as well after uploading. So That will help you in your real practice. Such a way, assignment topics are planned and provided to the students. Dr. Harshita, yes, okay. Namaste, doctor. Unable to meet. It's okay, doctor. I hope it is not a technical glitch from our side. Thank you for introducing. And you're from which place, Dr. Harshita? Have taken a year gap after UG, right. You're from Bangalore, yes. So I hope you will from this course and from the starting basic foundational months itself you will start refreshing the topics, and then we'll further move into the clinical part. The course is actually arranged in that way itself. Initial months will be covering the basics foundation, which you have to refresh, which you have to be very well thorough with the few of the terminologies, I can say. Post that, when I say terminology, I make sure that you thoroughly know about what are calories, how much carb you should take, how much protein you should take, like in an Indian breakfast system, how it would be. So all those things will be covered. Yeah, I don't want my patients to have guessing game in dietitians. Hence, I feel this was rightly said. Now, much of fad diets, social media diets, I don't know what all diets are happening nowadays. And Basila ma'am was saying, Vada drink, Pitta drink, Kappa drink. Everyone, the social media, Monday morning, everyone comes with one new diet and drinks. And a lot of game, we don't want guessing games. So something very authentic. Yet, when we say authentic, we make sure that this authentic thing should be conveyed to the layman also. We can't say that, okay, go to home and today you prepare rasala, shadava, you prepare fanita. We can't say this, right? So we should translate this into the layman's language. So we can't say that, okay, Hema Kirana Banaka is there. Tomorrow morning you go to home and start preparing and drinking. They will look at us like we are aliens. So we make sure that whatever we convey it in a layman's perspective with the right direction. Yes, Dr. Harshita, thank you for introducing yourself, and surely we look forward to having you in our classes, and be very active all throughout the course. Thanks. Doctor, your name, I can see only SJ. Good evening. Yeah, it's okay. If you have any doubts, you can ask Doctor. Need to ask one question, please. Can't you unmute? Is there any problem in unmuting? Is it for everyone currently? Most of you were muting, right? Is it just for these doctors?
Hello, ma'am. Dr. Sujata here.
Hi, Dr. Sujata.
Sorry for late joining. Actually, I just wanted to ask you, are you giving us any material to read, or are you giving some list for to refer the books or whatever?
Yeah. So, doctor, the list of books which you should refer during each of the classes, live sessions, modern nutritionists or doctors would be giving the name of some of the books which you should refer. But from our side, Ayurveda map side, we would be providing you with a module, complete printed module, but that would be shared with you towards the end of the course, mostly towards the end of the course, because that will comprise all the points which is covered in this 1 year. But we make sure that we upload the notes of the respective classes within 1 to 2 days.
Okay.
1 to 2 days, so that whenever you listen to the recorded version again, along with that, you can refer the PDF of the PPTs uploaded, right?
Yeah. Thank you.
Yes. Dr. Harshita, it is server promotion. Okay, no worries, doctor. So I got your point, and I'm sure you'll gain a lot from this course, Dr. Harshita. We look forward to having you. Next, anyone? Come on. Anyone would like to speak? And during this course, I encourage a lot for the participants and the doctors to speak up, okay, always, to ask the questions, to speak with the faculties. We have throughout the session in English, but you can ask, if it only face any difficulties, you can always talk in your mother tongue as well. We'll try to convey to the faculties also, no problem. But I'm quite sure you all are doctors, you all are practitioners, you know the basics of everything. So make sure you interact, okay? Make sure you talk, you speak up. Being doctors, that is the first thing we should have, a communication skill. Many AI things are coming, many AI doctors, and in few countries, recently we read the news, like even AI is getting the permission to revise the prescription. But what I feel that human touch or communication should be the last thing to be replaced in the current AI system. So doctors, what we currently need is a communication skill. The better we communicate the thing with the patient, the better we gain their confidence and trust. So these platforms, even though you may think what is there to speak in this Zoom platform, but that itself shows a little bit of courage from our side, right? I'm doing something for myself. You have chosen this course because you wanted to upskill yourself. You wanted to do something better for yourself rather than your just graduation or the PG. So speak up always. Let it be lame thing, let it be a minor thing. We all are here to learn, correct. None of us are perfect. So always try to speak up. All throughout the course, you will have to hear from me to speak up, because every classes end, I would be saying this thing to come up with the questions, ask to the faculties. I even call up the names. So be prepared, because this 1 year, I'll make sure that we grill you properly so that you get the best of this course. That's just your commitment. Anyone, any more questions? If you wish, you can ask. Otherwise, you can message in the number shared by Dr. Jasul or in the group which you are added. Yes, Dr. Jasul, anything? I think few of them have already introduced, few of them who have registered and already enrolled for the program.
So, yeah, we will start the session soon. So those who like to register, please register as soon as possible. And the number already given. Okay, I will post it again. Okay, so how many of you already joined? The students are there. Okay. So how many of you like to join? Just send me in the chat box. Just send me in the chat box. Yeah, Dr. Ovia. Just contact us. We will directing you, and any others. Okay, Dr. Litti, we can wind up. The schedules we'll be updating you soon. And as Dr. Litti said, be interactive in the live sessions, and we recommend you to go to attend all the live sessions. So that is that is the recommended thing for you. Even though we will be providing you the recordings, attend live sessions so that and take notes and interact with the faculty. Then it will be an added advantage for you in your career also. Okay. So yeah, Dr. Litti, we can wind up.
Thank you all for joining, and please do contact me the number which is provided, or if you have any doubts, you can directly talk to all the admins and providers in the group itself, or my number is there in the same group which you are being added. So directly call up me, or if you have any particular thing to ask regarding the nutrition or however it is, or some of the experience of the doctors so far, please feel free to interact and reach out to me as well. So I look forward to have a very good and a very good amount of interactive students with much of interest in nutrition. Thank you all. Thank you all. Have a very good night to everyone.
Thank you. And one more thing, those who already joined, you will have an session in which how to access the classes, how to access the recordings, and how to go through that. We will be informing you in the group so that you can join in that group, and you can just download our app and go through all these videos. So those who have any doubts or doubt regarding how to access the classes, we will be updating you. Okay. Thank you. Thank you.
Thank you, everyone. Thank you, everyone. Take care.
Yeah, thank you, Dr. Lithi.